Hi there, my name is Sarah. Thank you for choosing Hackensack Meridian Health. Today I'm going to be discussing with you a quick review of transplant medications. We're so excited for you. Congratulations on your new transplant. After transplant, there's going to be changes to your medications. Let's review those changes so you feel confident before you go home. After transplant, you need to be on immunosuppressants. Immunosuppressants are medications that prevent your own immune system from harming the new kidney or the new pancreas, and we don't want that to happen. So it's very important that you take your medications as per the schedule that the doctors give you. The two immunosuppressants that you might be on are called Prograf, also called tacrolimus or Tacro, and Myfortic. These two drugs are specific to you. We'll go over them when you're discharged. There's also medications that you're going to be on that are to prevent other infections that could happen from being on immunosuppressants. For example, common infections, common viruses are more high risk after transplant, and we don't want those to happen either. So we give you 3 medications to prevent them. Those are commonly called Bactrim, think B for antibacterial, that prevents pneumonia. Then there's Valsite, think V for viral, that prevents common viruses. And then there's Nystatin, which is an antifungal medication to prevent thrush, like in babies. There's some cases where you might need to be on an IV medication once a month. That's also an immunosuppressant. Your doctor will let you know if that applies to you. The immunosuppressive medications that you're going to be on are typically given at 9 a.m. and 9 p.m. We'll be providing you with a pill box that will have all of the medications you need to take in it. The nurses will also be going over every single medication, the side effects, and what you need to know while you're in the hospital and again before you go home. The pill box will have every single pill set up for you by our transplant team. Please don't take anything outside of the pill box unless otherwise directed by the team. If you have any questions about the medications, we're always here to speak with you about them. Also, please bring the medication box and the bottles that will be used to fill your medication box with you to all of your follow-up appointments until the team tells you you no longer have to. A common question that we get asked is, what medications can't I take? There's certain medications over the counter that are called non-steroidal anti-inflammatory drugs. You know them commonly as Advil, Aleve, medications that are frequently used for pain. After you receive a transplant, you can no longer take any of these medications. If you have any questions about these specific medications, please ask your doctor. These types of medications can be harmful to your new kidney. Always check with your transplant team before you take any new medication. There are other types of medications that may interact with your immunosuppressive medications, so it's very important that before you take anything new that you review them specifically with your provider. But there's a couple things that you should know. There's blood pressure medications such as Coreg and Cardizem that can interact with your medications. There's also anti-seizure medicines like Dilantin, antibiotics like Diflucan, and herbal supplements, also blood thinners like Coumadin, which are very common, that interact with your immunosuppressive medications. It's very important if another provider wants to start you on something new that you discuss it with your transplant team first. Another important reminder that we should discuss is that it's very important to take your medications on time. So what do you do if you miss a dose? If you miss a dose of your medications, but it hasn't been greater than 6 hours, then just take your dose as soon as you remember. But if it's been greater than 6 hours, then wait until your next dose is due. Do not double your dose. If you are vomiting and cannot eat or drink and cannot take your medications, please make sure that you call the transplant office immediately. And don't forget, the phone number is 551-996-2608. Please remember that all of this new information will be reviewed with you while you're still in the hospital by your nurse and by the transplant coordinator. And then after you're discharged, you're going to be following up in the transplant office with the team. Thank you for choosing Hackensack Meridian Health, and congratulations on this new beginning. It was a pleasure taking care of you on 9 Pavilion East.